about to hear a revolution in talk radio, Liberty Talk Radio, where the critical thinking will defrag your mind of propaganda-ridden viruses induced by mass media news programming. No BS here, just the facts.
And now we present to you America's quintessential iconoclastic anomaly. Wow. In talk radio, your host, Joe Cristiano.
Welcome, everyone, to Liberty Talk Radio, America's libertarian voice, broadcasting from our studio in Tulsa, Oklahoma, to around the world. I'm your host, Joe Cristiano, and this is your antidote to popular talk radio. Today, we're pleased to have a returning guest, Dr. Elaina George. She's a board-certified otolaryngologist. Now, for those of you who don't know what an otolaryngologist or otorhinolaryngologist is, that is a ear, nose, and throat doctor. My wife is not an otolaryngologist. My wife is an audiologist. She just does ears, you know. Anyway, but Elaina, Dr. Elaina George has been a phenomenal guest. She is in private practice now. She has sort of quasi-divorced herself from the mainstream medicine, is in private practice, and has become an advocate for the patient because of all of the government interference in the healthcare system. She's been a guest on Neil Cavuto, many of the major news broadcasts. She's been on our program twice before. Today, she wants to discuss 5 ways in which Obamacare is dismantling affordable health care. Now, she is with a patient now. She said she will be with us in a few minutes. So I'd like to just discuss health care for a second. What I find particularly almost amusing, if it wasn't so sad, is the fact when any time the government names something, labels something, it's usually the exact opposite. They say affordable health care. Well, the way it's turned out is that, and I've done my own research on procedures and operations that I have had, what I am now paying for in fees, you know, the residual that I pay, because I'm a retiree of a major oil company, and of course I'm over 65, so I get Medicare. So my health care should be free plus. I should be getting, every time I get sick, I should be getting a check in the mail. Only kidding, but you know what I mean. But yet, I had an operation a couple of years ago, and every month I was getting a bill for something. Now, I'll be honest with you, I did not know what I was paying. I read those bills. I had no idea what they were referring to. They referred to other procedures, to other filings, to healthcare sections. Totally unfamiliar, all foreign language to me, but it was usually small amounts. It wasn't thousands of dollars. It was usually in the low hundreds, like $372, $165. So being the nice guy that I am, and I'm a hell of a nice guy, I just automatically paid them. So I just paid every bill that came in. But it seemed like every other month I was coming in, I was being presented with another bill, not knowing what I was paying. Now, wouldn't it have been nice if I had an operation, and they labeled, you know, anesthesiology, the surgeon, the hospital room, the stay, you know, the medication. It's something simple that a mere human could understand. And they indicate what portion is being paid, you know, by your healthcare system and what portion is yours. It would be very simple. But it seems that all they do is have page after page after page of fees and credits and charges, and which I do not understand. So what I did after I thought I had paid all my operation, I'm still getting bills, and they just come in constantly, but for small amounts. I added up how much I was paying, the residual that I was paying, and then I looked at the invoice on how much the operation was. Well, this one operation, I think it was $161,000. I mean, I was flabbergasted. Never thought it would be this much. Well, I called a cash-only hospital, and I told them, I said, if I needed this operation, how much would it cost? Well, believe it or not, the amount that they would have charged me for having the operation at a cash-only hospital, bypassing Obamacare, bypassing Medicaid, bypassing everything, would have been about the same of what I was paying in the residual that I pay. So all the major portion, 90% of it, went to the insurance companies, went to government government agencies. Who knows where it went to? But all I know is that we're all paying a phenomenal price for government health care. Well, I think Dr. Elaina George is on the air now. She's on the air now?
Yep.
Okay. All right. Dr. George, thank you so much for returning to Liberty Talk Radio. It's so nice to see you. I can't see you, unfortunately. One of our monitors are down, so I'm going to assume that you're there.
I am.
Okay. Can you see me, by the way?
I can.
You
No
can?
problem.
You lucky girl, you. Well, I think today you wanted to talk about 5 ways in which Obamacare is dismantling affordable care. Just from my limited experience of asking people about health care, I don't know, I didn't have one person yet tell me that, now they have affordable health care since the government got involved. Every single one is telling me how much they cannot no longer afford health care, although it's affordable. Could you unravel that for us, please?
Well, you have to understand that it's a two-tier system, and the insurance side of it is built on nothing. It's almost like looking at the economic system and the Federal Reserve. They create charges out of nothing, and the value that they place on them are arbitrary. So what you just described when I was listening in, and you getting charged some crazy amount of money going through the regular hospital system to get a surgery, it's not the real value of the operation. And they make it up as they go along. So when you ask somebody in the hospital setting, how much does it cost for endoscopy? How much does it cost to have a surgery done? They honestly can't tell you until you've done the procedure and had it done. Then they produce these charges. My office manager's family member went to an ER because she had abdominal pain. Turns out it was an ulcer, and she presented her insurance card. She got a bill back for $10,000, and with the letter stating that it's not covered because it wasn't an emergency. It wasn't medically necessary. Now, I don't know what you call medically necessary, but excruciating pain that you think you're having a heart attack or dying from is technically an emergency in my book. And then when you get a diagnosis that can be life-threatening, that should seal the deal. But the insurance company is now in the position of practicing medicine. So on the conversation yesterday, they were told that unless you're bleeding or you're in an accident, that's not considered to be, anything else is not considered to be an emergency, and you should go to your urgent care or somewhere else. This is what they're doing. This is why the cost of healthcare has gone through the roof, and people are not accessing it in a proper or timely manner. And when they finally get in there, they're getting sticker shock.
Yeah, well, I understand that. For example, United Healthcare has dropped out of the system. What happens when these insurance companies continue to drop out of the system? And let's assume that all of them drop out of the system. What happens to affordable health care?
Well, you're talking about a monopoly, aren't you? So you're the only game in town. You're too big to fail. You can charge whatever you like because there's no competition. That's where we're going. There's a county in Arizona where they don't have any commercial insurance available at all. So those folks are out of luck, and they're stuck with whatever they can get. And they're going to gouge people in a situation like that. It's completely artificial and arbitrary. And it's never enough. The profits are never high enough. The cost that the patient has to pay out of pocket is never high enough. It just keeps going up, but the value keeps going down. This is not a situation where people are going to really they don't like it now. Just wait, it's going to get worse.
I had a doctor in our family. He's a second cousin of mine. We called him Dr. Pete. And when I was a very little kid, hold on a second. I have an echo in my I have an echo. Can you get rid of that echo, please? Thank you. We called him Dr. Pete, really a nice guy. And I recall as a child going to his office, and I think he may have had an assistant and himself. That was the whole office. And you'd go there, and if your appointment was at 3 o'clock, generally you saw him at 3 o'clock, and he sat down with you. And now I was a little kid. I didn't fill out any forms, but I don't recall seeing all this paper and all these people inputting all this information. And you went to speak with him, and he gave you a diagnosis, helped you out, and you left. And it was usually a 15 or 20-minute session in its entirety, unless there was something big where he had to refer you to a hospital or something. But that was rare. But it was such a simple thing. You went in and left, and it was very inexpensive. My mom, she would take out her wallet and pay cash, and that was the end of that. It seemed to be a very simple system, and it seemed that even at that time, and I lived in East Harlem, we weren't rich or anything like that, where everyone could afford health care. And I even recall a doctor coming to my house when I had the flu. Now, I don't think that'll ever happen again, but it seems like every time I want to make an appointment for a doctor for something simple, I went into one doctor recently where I filled out, I was referred by a physician to go to a pain center for a shot. That all they do is wanted to give me a shot. I already had all the medical stuff done. I had to fill out 14 pages, I counted them, 14 pages of information to get that shot, even though I was referred by a physician wherein I already filled out those papers. He had all the information already. Why all this? Why all this mess? I don't understand it at all.
It's what you call bureaucracy. And it's a lot of the stuff that we fill out as physicians is just as bad as you guys. When you come into a doctor's office, making sure that the HIPAA compliance is in place, that you answer or ask the patient about meaningful use if you take Medicare. And meaningful use meaning every single personal question you can possibly ask, whether it's appropriate for your specialty or not. How many children do you have at home? How many guns do you have in your house? Right. Have you ever tried to hurt yourself? If your child thinks he's a boy or a girl, all these are things that the government is asking for. But when you think about this as a bigger picture, it's about population medicine now. We are now part of the UN-driven World Health Organization system, and we're the last developed country to join it. It's otherwise known as socialized medicine. Yeah. But what it really is a lot of metadata and data gathering and trying to social engineer things. So they're trying to teach people at this point that you should be happy with less. That if you lived, until you're 60, 70, 80 years old, that you lived a good life and you should not take it from the young people. You should just go into a hospice and forego your medical care because it's fair. And it's teaching young people that the seniors did it to you. It's their fault that you have to pay so much money. So it's about divide and conquer. It's about pitting people against each other. But the ultimate goal, and I'm still convinced of this, I wrote about this since 2009, that is about control. Control of 1/6 of the economy, control of doctors' behavior, and control of patients' behavior, all as an underpinning for a big tax. So people are paying by their, whether they like it or not, they're paying for subsidizing people who enter this system. That's one way. And the other way is they decide they don't want to enter this system, they have to be taxed because of it. So they're collecting a lot of money, but ultimately people are waiting longer. They're getting less care by less seasoned people. So doctors aren't really the head of the system anymore. It's actuaries, it's administrators, and maybe you might get a doctor in the mix somewhere in there, but it's increasingly becoming that their fiduciary responsibility is to the hospital or whoever they're employed by instead of to you, the patient, as your advocate. And that's a problem. That means the Hippocratic Oath is going by the wayside. That means the doctor-patient relationship doesn't matter. And it's all about value, supposed value, and outcome, which nobody can guarantee you because medicine is just as much an art as it is a science. And people need to really think now about the direction that the country's going, because if you don't like it now, depending on who you vote for, it's going to be doubling down on this. And I think eventually, if we stay on this course, it will be single payer, where you don't have even a private choice of who you go to.
Boy, that is so frightening. In your opinion, who would be the better choice from a healthcare perspective? Donald Trump? I know the Libertarian probably be the best, but the probability of Libertarian winning is kind of small at this point. But Trump or Hillary?
Looking at being pragmatic, it would have to be Donald Trump because he's not going to double down on this particular pathway that we're on. I think people need to understand that Obamacare is Hillary Care. It is the same thing. They just were smart enough to roll it out in a slower manner. And they knew that this thing was set up to fail. My most recent blog is entitled Obamacare, A House of Cards. And if you think about how it's been structured, you wouldn't be surprised that it was going to fail like it's doing, a slow car wreck eventually, essentially. So, for example, insurance companies work by having healthy people in their pool so they can keep the prices low. And the Affordable Care Act was set up where people can keep their kids on their plan until they're age 26. That meant a lot of healthy young people were never going to access this system, right, or they were going to do it kind of slowly.
Right.
And that set up the thing to be more expensive because it had a flood of people who were sicker, older, waiting for health care. And ultimately, that's why one of the reasons it got skewed, so that it's so expensive for everybody. Then you subsidize people, and you pay the insurance companies whether they have enough people in their plan or not. So you're giving corporate welfare to the insurance companies, which of course promotes bad behavior. Since they don't have to worry about keeping prices low because the government is paying them no matter what, they just did whatever they wanted to do. So now they're jumping off the ship because the government's going to get rid of that program. They'll stop paying them for basically staying afloat. And now we're seeing what the government sowed. So there's a lot of things in this system. It's not created in such a way that it was about patient care. It was always about, helping your friends, about making the system work for them. How else can a mandated system work for a patient when the insurance company is getting to double dip? That doesn't even make sense, does it? Mm. And so what we're seeing and what we have seen over the past 8 years is consolidation. Less insurance companies. We're now down to 5. Less hospitals, where the rural hospitals have been decimated. The community hospitals, doctor-owned hospitals, you can't really find them anymore. Now we have big hospital corporate systems where maybe you have 1 or 2 different systems in your community. If you're lucky, usually maybe there's one, and that's all you can go to. And they're setting the price in the market. They're removing competition by pricing people out. It's kind of like limbo. How low can you go? Right. And when the reimbursements hit a certain level, it got rid of a lot of the independent doctors because we can't afford to stay open, and the cost of doing business is prohibitive. So we've gone from 55% of the market of doctors to 30% just since the Obamacare law is passed. And that means people have no choice but to go into the hospital system like you just described, where they just jack you with prices for radiology, labs. Right. I mean, it should not cost $900 for an IV. That's ridiculous. Right. When I know I can send a patient for a $350 CT and that same test was $6,000, something is wrong, and nobody is trying to change that part of the system. So anything that Donald Trump can do that takes us off that track, don't fund it. Take away you don't even have to do a lot of work. Get rid of the mandate. And I think people will become consumers and find, cheap, efficient, quality alternatives that will actually put pressure on this system. I mean, their whole mindset is the government has to control it in order to control costs. But what really happens is the government gives that money to its friends and corporate welfare. And they end up rigging a system where it only works for them and they get rid of any competition. That's what we're actually seeing. But it's now taken from the boardroom to the hospital setting.
I had a very discouraging session with my doctor when I had my semi-annual checkup. All right, hold on a second. We want to fix that camera, please? There you go. Someone just stepped over a wire and moved the camera. Okay. And my primary care physician I have known for about 30 years. And we're like old friends. Last time I saw him, he was so depressed. You can tell. I walked in. As soon as he walked in, it was like doom and gloom. I said, I have a couple of questions for you, Wayne, And he says, 3 questions and 3 questions only. We have exactly 15 minutes for this procedure. Now, he never spoke to me that way. Never. I used to give him a hard time. I've known him for 30 years. After 30 years, you get to know someone pretty well. But it wasn't him speaking. He was so depressed, so down. I mean, I was surprised he just didn't drop everything, take his white coat off, and leave. And I wasn't angry with him. I felt badly for him. I felt badly for the whole system. I felt badly for everyone, including myself, by the way. And I left there and I said, that was the worst visit that I had with a doctor in my entire life. And I'm not blaming him. Don't get me wrong. I'm blaming the system because he was telling me this is what he's permitted to do. He starts at 7 o'clock in the morning. He gets out at 8 o'clock at night, and he looks awful. I mean, he looks like he just got drugged through a war, and he's just had it with computer setups and putting everything in. And no time. I'm of no consequence. He has to do all the procedures. All the paperwork. That's important. To me, whether I live or die is immaterial. And I always felt that way. And again, I'm not blaming him. I'm blaming the system.
Designed to dehumanize people. You become a cost center and a means to making money. And on an individual level, when you know your doctor and you have a rapport, you talk about each other's family and you actually have a relationship, that's a completely different style of medicine that is not valued in this system. The pendulum is swung, I think, almost as far as it can swing at this point. We now have doctors who have emergency room physicians, hospitalists, those that are actually just work in the hospital. They don't do anything else. They're being made to see so many patients now that they have to see, 18 an hour. How do you admit 18, acutely ill people into a hospital like it's a conveyor belt? You don't have the time to ask questions. You don't have the time to think. You're just getting them in, getting them out. That is not the kind of healthcare system that anybody, I don't care if you're progressive or conservative, wants. And that's exactly what's coming online. They're now talking about unionizing some of these doctors because their working life is so onerous. It's like slavery. I mean, you're putting the numbers in. You've got to get them in, get them out. Otherwise, your productivity is rated. You might be peer-reviewed as a problem doctor, never to practice again. There's so many things that are happening that doctors never speak about. But it really is the corporate puppet master via the government that's driving this. And I don't think that, and this is the problem, healthcare has been quantitated as a right. It's not a right, it's a service.
Right.
If you really think about it,
correct.
You don't have the right to demand my labor as a surgeon. You don't. When you become my patient, I have a responsibility to you to take care of you to the best of my ability. But you can't tell me how long it should take me to get you better, what medicines I need to write for your problem, and if you don't fall within those parameters, somehow it's my fault. That's what having a right means. And that means the government can take it over, which is what they're trying to do everywhere. I don't care if you're a teacher, if you're a lawyer, if you're a doctor. This is bigger than us. We're just one piece of this whole. I think people really need to critically think about this and start reading instead of thinking about what you're told to think. You need to start doing your own thinking.
I would imagine that many doctors are jumping out of the system, getting out of the system altogether. And are there many doctors who are just going into private practice with no affiliation to the Affordable Care Act, just sort of a cash-only hospital, cash-only doctors? Are they permitted to do that today, or will they go to jail and suffer lifetime sentences?
Right now we're allowed to do it, but I think once the grid is locked into place, there will be some complications. They're trying to start a national licensure for physicians, which would be an absolute disaster. That's becoming, the government control of your licensure, which means if you don't take Medicaid or Medicare, I'm sure, if you don't take Affordable Care Act, if you don't charge a certain price for your services, you will not be licensed. That's what the ultimate goal is. And they've pushed this forward in Hawaii. I think Maryland, one of the Maryland congressional folks were talking about it. It's on their agenda. And this is all piecemeal. You're dismantling the medical education system. When I went to medical school, our goal was to be a solo practitioner when we got out. Would hang up your shingle, become an entrepreneur and take care of business and be your own doc. That's not how the medical education is being, the people are being trained now. They want to be part of a group, part of a team, where they go into a hospital, they're working 9 to 5, and when it's 5:01, they're out of there. There's no hand-holding of your patient. There's no real calling them after hours. They're not doing that. They're not trained to do that. The Hippocratic Oath isn't even taken by some medical students anymore, which means that do no harm. You can't, perform abortion. You can't perform euthanasia. That's gone. That means you're now in a system where it's okay to pull a plug. It's okay as long as it's the fiduciary responsibility. The cost effectiveness is what comes out first. And even the way they talk to patients now, it's, put them on, even if you have, and this is, people don't even understand this, if you have a living will, they can ignore your living will legally. So bioethics panel meets, they decide that your disease is too far gone, you're too sick. They're just going to meet and put you on some morphine and not tell you, your loved ones, about it. So I recommend to anybody who's got a loved one in the hospital, please be involved with what's going on with the doctor. Have conferences with them. Don't just assume that they have your best interest of your loved one at the forefront. It's about whether they're going to be paid by the government. And the new doc fix, the new law that went into effect that puts forth value-based medicine, is a perfect example of how it sounds good on paper, but in actuality it's going to do the opposite. It's a capitation plan on steroids. So the government gives a certain amount of money to hospitals now each year, and their profit is based on how much money they keep at the end of the year. Right. So every service that they provide, every CT that's ordered, every lab test that's ordered, comes off their bottom line, so they're going to make less money. So now we're seeing doctors with the pressure not to admit someone, treat them by telemedicine, get them out as fast as possible into another facility or home, but don't keep them in the hospital past their designated time frame. Well, and don't readmit them, because if you readmit a Medicare patient within 30 days with the same diagnosis, the hospital doesn't get paid. What kind of system are we creating? Right, the pressure is to make your money and run. Forget about the patient. Forget about the outlier. Just do the conveyor cookie cut, conveyor belt medicine. And whoever falls outside of that, oh well, it's the doctor's fault, the hospital's fault. Someone's going to eat the money. And it's tragic, frankly.
Yeah. Has anyone benefited by the Affordable Care Act? For example, the poor who may have not had any insurance whatsoever, are they getting better health care, or is everyone suffering the same plight?
That's a really good question. Obviously, there are people who have been helped by it. To say no would be, wouldn't be telling the truth. But to help the percentage that they have helped, it's really turned the rest of the market upside down. And if you look at numbers and they start touting numbers of how many people have coverage now, you have to remember who those folks are. A majority of them actually had insurance, but their plans were dismantled, so they had to join the Affordable Care Act. Or their company won't cover them, so they have to go into an exchange, etc. Most people actually have ended up on Medicaid, not on private insurance. So the Medicaid rolls have actually gone up. Another group has been illegal immigrants who've been put into Affordable Care Act when they're not really, it's not written that way. So anything they could do to make the numbers look better, they've done. And they're not taking into account that most people, sure, there's some that love it, and I have more power to them. I wish them all the best. But a lot of people, especially middle class, have joined it because they had to, found out how expensive it was, and jumped off the next year. And the fine is cheaper than paying the premiums and the deductibles for these people. So it's a transfer of wealth. That's what it's turned out to be. Yeah. And self-rationing has been going on and it happened to me today, where a patient didn't want to have a test done because the out-of-pocket was too much money. They're paying their premiums, but hey, they can't cough up another $500, $2,000. I've seen people come out with $10,000 deductibles where it's prohibitive. So they just don't come.
Right. It's having a $10,000 deductible is like having no health insurance at all.
Right. But they get to be counted as carrying insurance in this model.
Now, I didn't know, Doctor, that illegal immigrants qualified for the Affordable Care Act.
It's been trying to do that to make it legal, but no, they do. So
That blows my mind. Okay. Well, I guess nothing more is to be said. If you wanted a good health care, if you wanted affordable health care, which country would you go to? Obviously, it's not the United States anymore. I know Canada is probably not too much better. Where would you recommend that I flee to?
You know what? I would stay right here, but I would use my own money. I would contract directly with an independent doctor, independent hospital, independent radiology center or lab, and get the actual cost of what your healthcare problem is. Surgery Center of Oklahoma is my perfect example for this. I have a patient who needs to have surgery, and I tried to call up one of the major academic centers. They couldn't even tell me how much it was going to cost, and she actually had to submit the paperwork, have it looked at, pay up front before she even showed up at the facility. And I said, I can't do this. She couldn't either, so we called up Surgery Center of Oklahoma, and the whole thing got the whole rate by phone, and it was going to cover everything from the time she went in, anesthesia, all the doctor operation stuff, everything that she would do as a package, and out the door. And there's now something called Med Retreat, which is medical tourism, but in the country. So if you don't want to leave the country, you can actually find doctors and facilities that, again, will give you a package price. But this is the really neat part about theirs. And I think Surgery Center of Oklahoma is the same way. If you have a complication, you don't pay any more. That's included. In case there's something that goes on, you're not going to come and pay a double or pay again out of pocket. It's about customer service. Yes. That's what people need to know. And if people start voting with their pocketbook and start making consumer-based choices and not deal with the only game in town, that's how we're going to make changes in our healthcare system. Everybody seems to understand money. Just like that EpiPen fiasco where they wanted to raise it $600. All of the outcry and the people saying, we're not doing this, they back down, and now, lo and behold, the generic is going to come out. So we need to do that, have that mindset about the entire healthcare system. And armed with the knowledge that if I pay for something, it's going to be a lot cheaper, I'm going to get it without any delay, and I'm going to get quality healthcare. Right. And I'm not going to have to pay for the same amount that I'm paying elsewhere. And medical cost sharing, the health sharing companies are a great resource. Again, they started out as Christian sharing ministries. There's about 5 of them. But there's one called Liberty Health Share that has a libertarian mindset to it. So you don't have to be Christian. You don't have to belong to a church. But you do have to pledge to follow the tenets, which is sharing in each other's health expenses and being honest. Your word needs to mean something, and you need to take personal responsibility, which is totally reasonable. And it's a fraction of what it costs versus accessing your insurance plan. And it does cover any doctor, any hospital. It actually, truth means something when people are joining together to spend their own monies. Right. And they're actually able to access the free market side of the healthcare system. So they're getting those discounts for you. All you do is present your card. So there's a lot of things out there already, tell you the truth, that you don't have to work so hard. Go to blinkhealth.com. That's a discount website that you can buy your pharmaceutical medication, whether it's brand or generic, prepay for it and spend a fraction. So free market is alive and well. You just have to know where to go.
Right. I was absolutely shocked after I had knee surgery. I had replacement knee surgery. I don't recall what it cost. The bill was phenomenal. I was shocked when I saw the actual cost of the operation in the hospital and whatever. And I said, I'm going to call the Oklahoma Cash Hospital and see how much they charge for the whole thing. I don't remember the numbers, but I think it was like 1/10 the amount. Is my memory fuzzy, or is that possible?
And anybody listening to your show now can just Google it, or better yet, go any other different platform. Frankly, not Google. Just look it up online, and you can put in what your process is: thyroidectomy, tonsillectomy, whatever it is, and you will get a price that's set in stone for how much it will cost for them to do the procedure from the time you walk in to the time you leave.
About 1/10 of the cost is not about right. I think we have a caller. Can we get the caller on the air? I know we're having some technical difficulties. Doctor, we'll take one caller, and then we'll let you go and see your patients, okay? Caller, you're on the air. Your caller? Yes, your question or comment, please. Hello?
Yes. Hi, can you hear me now?
Yes, I can hear you well. Thank you.
Hello?
Hello?
Okay. Hello, this is Patty in Tulsa. And hi, Dr. George. I've been listening, and my father was a hospital administrator of the old guard. He would truly be, well, his ashes are quaking now to see what's going on. It's very distressing. And I wondered, which area do you think is the area of most concern for us to try to make changes? Is it with insurance companies? Is it with pharmaceuticals? Or is it mainly keeping government out of it?
That's a great question.
Because I'm all for doctors. You're doing everything great. And my dad was all about patient care too, as well as my brother, who's a doctor, and my sister, who's a nurse.
Everybody seems like they're in the fight, so thank you for your question. That's a really great question because they're all intertwined. It's like a triumvirate of the government, the insurance companies, big pharma, and I guess we can add in the hospital corporations too. It's corporate driven now, and the way the power and the way it's set up, it's a pyramid where those at the top are running the show. They're setting the agenda. They are driving what constitutes good medicine. Our option still is to contract with each other. Find a doctor who thinks like your dad did, and I'm sure your siblings do, and go to them. Bring your business to the people who value you. And it's not about some middleman stepping in. The direct primary care practices and direct pay practices are the wave of the future. I truly believe that because it's about privacy. It's about patient-centered care for real. And it's getting out the administration and the compliance people who are making all the prices so high. I mean, the old-fashioned medicine that you described, where the first dollar was spent between the doctor and the patient, not with the insurance company deciding who gets what, divvying up the pie. They literally place themselves in a position as if they do something. They don't. They make the whole system work poorly, in my opinion, and they cost everybody more money. So the way we do it is we take our power back. We open up our own practices. We cater to the people who are self-pay or high deductible. We cut them a deal. We make our prices transparent, and we make what we do already, better. So we innovate. We make it cheaper. We make it less invasive. And we become a market that people can pick what value they find the best and use it. So that's how I won't think the answer is the government. And I don't think the answer is someone taking care of us. Ultimately, we need to stay healthy because the best way you stay out of the system is not to get sick.
No more ice cream, Patty. You know that. Okay? Patty, no more ice cream. All right? You know that now.
Darn. Okay. I'll lay off. Thank you.
Patty, thank you very much for calling in. Thank you. Doctor, we're about out of time. I'd like to give you the last minute just to wrap things up.
Well, thank you for having me on, Joe. It's always a pleasure to be with you and your listeners who I think really think outside the box. And again, I just want to emphasize that all is not lost. If you make proper and conscious choices, there's a wealth of things you can do to help yourself. There's a thriving free market avenue of healthcare out there, already exists. If you go to my website, drelainageorge.com, I have links to American Association of Physicians and Surgeons who list doctors all over the country who think like I do.
Great.
They have direct primary care practices, blinkhealth.com, which is that website I talked about for pharmacy, MedRetreat. I also wrote a book about this called Big Medicine because I actually wanted people to understand how we got to this point. It's bigger than us, but we still have the power. They can't run a system without doctors and patients. And if we stop giving them, just volunteering our value to them, they'll stop taking it. Yeah. So
let's
I'm a
hope
big fan of I control my own destiny, not them.
Let's hope all the doctors go to the system, and so there'll be no one to administer anything other than if people want to pay cash. And I guess that's the ultimate end game of it, and everyone will win that way. Unlikely it'll happen, but maybe there's some hope there.
Hey, you don't need to be the majority. You just need to be out there and be an alternative.
Right.
And honestly, I'm all about choice. If people like this, like Affordable Care Act, go for it. But if you don't want it and you want an alternative, it's out there, and that's what this is for. Not everything fits everybody, and that's what makes it so beautiful.
Right. Well, Dr. George, thank you so much. You are absolutely delightful guest. Love having you on. You're one of my favorite guests, by the way, and I'll be frank with you. I really mean that. And I do hope you will accept our invitation to return at a later date and give us an update.
It'll be my pleasure. Thank you so much.
Thank you, Doctor. Folks, this is the end of today's broadcast. We'd like to thank our sponsors for the financial support, and we'd like to thank you for listening in. You can further the cause of liberty by recommending this program to your friends. Let us hear from you. Our email address is comments@libertytalkradio.com. Remember, you're either allowing your liberties taken away or you're striving to protect them. Unfortunately, there is no middle ground. Until next time, this is Joe Cristiano. You've been listening to Liberty Talk Radio. Stay well. Stay tuned.